Good morning, everyone. Buongiorno, bonjour, guten Tag. I think I'm at the limit there. Good morning, welcome. I'm so happy to see you here. And also for those of you joining online, welcome. Some of you, it's morning for you, some it's very early morning for you, and for some of you, it is afternoon and evening. And I really appreciate you being here and look forward to your participation in the summer school in an online environment. We are going to get the noise, the background noise to lighten a little bit. Perfect. Yeah. So we are all here in Lugano or online for the 32nd edition of the Lugano Summer School, which is pretty remarkable, I think, that we've been at this for 32 years now. My name is Suzanne. I know many of you, and those of you whom I haven't met yet, I look forward to getting to know this week. But really welcome. I'm very happy you're here. We have a few people who will be joining us later this afternoon because of delayed flights and so forth, so we'll give a proper welcome to them later. So some of you are joining us for the Summer School in Public Health Policy, Economics, and Management, and some of you are joining us this morning because you're part of the Middle East Mediterranean Summit. And I want to welcome both of you for the first time ever that these two fantastic events have joined forces in a collaboration. We tried to in 2020. We had an event planned for the two groups to come together, and unfortunately, everybody got canceled, and we went online. So I'm very happy that we finally could make it here together. The Summer School in Public Health, as I mentioned, it's 32 years old this year, and we take our mission seriously. Our mission is mutual learning for change. So we bring together practitioners, academics, those in policy and making and policy informing. We bring people from all over the world together to share experiences, to learn from each other so that you can go back to wherever it is that you live and you have new tools in your toolbox. And you also have a fantastic new network of friends and collaborators from across the world. So we take this seriously. We don't have students here. We don't have teachers. We have facilitators and participants. So we invite you to share with us and exchange with us things that you're doing in your country, things that you would like to do, things you do in your work, things you do for research purposes. So we started in Ascona, a beautiful place on Lago Maggiore, not far from here, and we moved to Lugano in 2009. As you can see here, we started in 1991. We left Ascona in 2008, not because it wasn't a beautiful place, but it was a little bit hard to get to, and it didn't accommodate the high numbers of people that we have attending the summer school. A few years ago, I took charge of the summer school after our dear colleague Gianfranco Domeneghetti had started this fantastic summer school and run it for so long. And then my good friend and colleague Luca Crivelli, who's here today and still remains on the steering committee, was in charge of the summer school from 2008 to 2014. And he set the bar pretty high. Many of you know him and you know what a wonderful experience it was working under his leadership. And then a good colleague, an economist here at UCI, Fabrizio Mazzona, was in charge for several years and did also a fantastic job. And then the first non-economist and the first woman took charge of the summer school, and a pandemic hit. So last year was my first year to actually get to welcome people live after 2 years of online. But I'm committed to making sure that we continue the spirit of mutual learning for change, but we reach more people and a broader audience. So I'm committed to a hybrid summer school. And while everybody would love to be here, and I would love everyone to be able to enjoy Lugano, from an environmental perspective, we need to travel less. And so for those of you who are joining us online, thank you for being there. Thank you for bearing with some of the technology issues, and I'm sorry that you don't get to experience this face-to-face. But we're going to continue to grow. We're going to continue to try to do things a little bit differently. For example, last year, I said, I am committed to bringing young people into the summer school. I didn't quite know how to do that yet, but we've done it this year. Today, after our plenary, in our plenary talk, we're going to have 4 young people, 1 from UK, 1 from Italy, and 2 from Bangladesh, who are going to share their experiences as young people and their perspectives on health and well-being as young people. So we'll continue to do better and involve more young people as we move along. MEM, those of you from the MEM, welcome. We're really happy that you're here. You were invited, as you know, to participate in our activities, and also want to thank the organizers of MEM for inviting all of the public health participants to participate in some of your activities. So you all know from the eCampus announcements that we're also invited to watch a film during their film festival, a wonderful film called Climbing Iran, and also then their summit on Saturday. So please have an opportunity, take the opportunity to meet and exchange together. This summer school, we also did this year for the summer school, we also did something else that was different, is that we held a webinar in the springtime, and which we never do. We're always just focused on this week plus a small pre-course beforehand. But we held in a collaboration with the Swiss Mental Health Network, we held a webinar called The Concept of Gross National Happiness, Ideas from Bhutan, Ideas from Switzerland. And it was fantastic. So I also want to thank my colleagues there for participating, for sponsoring that activity, and for all of you who didn't get to join. It is recorded, and think about next year. In April or March, we'll also do another online activity. This year, we have 14 fantastic courses in public health policy, economics, and management. Also focus on behavior change and communication, and how do we strengthen our health systems? How do we deal with ethical problems? And how do we learn from the past? And that's something that frustrates me a lot, is the fact that we have such a difficult time learning from our past. Spanish flu, anybody remember that? And what are we going through now? It's frustrating. But if we learn from the past, then we can move on and we can be prosperous and we can do better. So we have fantastic courses: air pollution, wealth inequalities, responding to disasters, the importance of humanitarian logistics, strategic project management, social media, the course that just took place last week. We have systems modeling, NCD, a course focused on NCD, ethical issues, community-based participatory methods, making sense of evidence, adaptive evaluation, promoting health behaviors, understanding how we finance our health systems, and like I mentioned already, learning from the past or not. So this year we have 192 participants. So this is also a benefit of hybrid, because if we're only on site, we have limited capacity in the classrooms and in our mensa, our cafeteria. So we have 192 participants joining us from 57 nations, plus the MEM participants that are all joining us today. So we're very, very happy to have you. We have 4 plenaries this year. This morning, you'll hear about youth health and well-being. Tomorrow evening, political economy of global health. On Thursday morning, we'll learn about ChatGPT and AI in healthcare. And that evening, we're going to learn about migration. Lots to do about migration, so we'll just touch the surface in terms of migration and health. We have many networking events, starting with this morning. This evening, the public health participants and faculty are invited to the Lido. So whenever you go to the Lido, you go basically this direction, straight to the lake and turn left, and we'll help you get there. But please join us. It's always a spectacular event. And I think we could use some fresh air and some good cold water at the lake after this really hot day. On Wednesday evening, we have a film festival, and I'll describe that in a moment. And then on Friday evening, we're going to finish off the last evening of the week with a fantastic party right here in the garden, focused on healthy lifestyles, where we have lots of things to share with you and games to play and wonderful food and excellent wine and sparkling wines from Ticino. So also sustainable. The food and the wines are coming from locally sourced. We have 2 exchange sessions where we're inviting participants to share what they do in terms of their work, their research, or their practice. We have 31 people who have subscribed to these exchange events. Everyone is invited to join. They'll be in the red building, and I'll share more information about that with you later. And then coffee breaks after each plenary, each morning plenary, we'll go just downstairs to the covered area. We call it the cement roof, but we won't stand on the roof. We'll stand under the roof, and we'll have a coffee before you all leave and go to classes. And then every afternoon, we have a designated room in the red building for coffee breaks and some refreshments for you. The second Swiss Global Health Film Festival will be held this year. Last year, we were dedicated to conflicts. And so it was a pretty heavy, with three films focused on different forms of conflicts. Fantastic. It's run by the Swiss School of Public Health PhD students. And this year they have decided to focus on animated films. And they found one called Ice Merchants, which is about climate change. It's a 14-minute film, so not too heavy at the end of the day. And it's not about conflict. It is about climate change, though, also something very, very scary. And as you can see here, it's the first ever Portuguese animated film to be awarded at the Cannes Film Festival. So please, please plan to join us on Wednesday. All are invited. These are open events for anyone. So even if you want to bring some friends, please know they're welcome. This is a shot last year from the Lido event. So last year on the Monday night when we went to the Lido, a group photo. We're going to be taking lots of photos this year. Here again, just to give you a sense for what we experienced last year in the plenaries and in the classrooms. And then, of course, in our networking events. So we invite you to take photos. And hopefully you have signed the consent form saying that it's okay that we take your photo and we use your photo. If you don't want that to happen, if you don't want your photo taken, or you don't want us to share your photo, you also, of course, have the right to do that. Be sure and let Amelia know that that's your wish, and we will respect that. This is from the Healthy Lifestyle event. Not only did we all practice yoga and we ate wonderful vegetarian locally produced foods, but we also did some jump roping. Here we have the Dean of the Swiss School of Public Health, Nino Kunzli, who is here in the audience as well. Jumping rope. You're never too old to have some fun, please. And we will have more activities like this for Friday night. So if this doesn't entice you to attend Friday night, I'm not sure how to entice you. It was a lot of fun. And it was rated our best event from last year. This year, what we want to do is make sure that we all have an opportunity to share photos. So I invite you to download the SAM app. I have the QR code here, so you can scan it. At the end of the session today, I will also upload the QR code. I'll show you the QR code again. And it's also printed on the table where you picked up your badges. And you can this will take you right to our group. And you can then take photos and upload photos so we can all share them. You can download them later so you can have a good memory, a good photo memory. So this event would not be possible without an entire team. So I'm going to quickly go through the team, not because I don't think everyone needs a long introduction, but we don't have the time to do that. We have a fantastic speaker talking soon. So this is the group of people who works really hard all year to make this event happen. And I want to thank each and every one of them for doing that. So everyone here is a member of the steering committee or the staff. Those of you who are in the public health summer school, you all know you have access to eCampus, and Joachim from the Swiss TPH is very kind and very dedicated to making sure you are all in that platform and have access to all of the things that you need access to for the week. We also have an advisory board. A few years ago, actually 2 years ago, we decided that we wanted a higher level advisory board to make sure that we were up to date on the biggest needs for global health around the world. And so these fantastic people dedicate their time on a volunteer basis to help make sure that this meets the needs of global public health. So thank you sincerely for those of you serving on this advisory board. Every course this year has an assistant just to help make sure things run smoothly. They have been working very hard to make sure they understand the technology and that you will have a good experience. They have been making sure that you have access to eCampus, so you should have gotten a message from them welcoming you. And if you hadn't access to eCampus yet, you probably got a message already to see if you needed any help. They will make sure that you know where to find lunches, everything. They are fantastic. Thank you very much, all of you, for doing this job. We have around 40 facilitators who help make this the summer school amazing. So I'm going to scan through them all. You'll recognize some of them already, and the others I really invite you to get to know. So in our social events, the facilitators will be joining, and I really want you to take advantage of having a nice, light opportunity to discuss things with them at the social events and also the lunches. So now I would like to turn it over to our first expert who's here to talk with you today about youth and health and well-being. So Alexander Schulze is from the Botnar Foundation. You may know the Botnar Foundation is a fantastic foundation based here in Switzerland who does really wonderful work in LMICs and beyond. And Alex has decided that he would be not only serve on our advisory board, but he'd be happy to also give a talk this morning. So I'm going to turn it over to Alex. He will give you an introduction to the topic, and then we have 4 young people who will join us on the panel. We have Tugala and Martina, who are here, right here in the audience. And then we also have Ria and Naksatra from Bangladesh who are on Zoom. And so we will bring you in at the end of Alex's talk. We'll have a discussion about what's a priority for them as young people, and we open it up to all of you to contribute to that discussion as well. We invite you to participate and not just be observers. Alex, I'd like to turn over to you. Welcome. Thank you for being here.
Well, thank you, Suzanne, for inviting me and for the opportunity to talk about adolescent health and well-being. I'm delighted on the one hand. On the other hand, I have to say I'm a little bit humble because I'm the first one to speak after the welcoming, but also because I'm relatively new to the topic, I have to admit. So I've been with the foundation now for 1.5 years. And Suzanne mentioned it, the topic of Fondation Botnar is actually to strive to contribute to young people's well-being. Health is just one part of it. And admittedly, I've worked on global health quite extensively in my previous career with the Swiss Development Corporation and a corporate foundation before, but really never specifically on adolescent health and well-being. But I hope with that 50-minute introduction to a little bit of a lively discussion, I can spark your interest and your passion for adolescent health and well-being. At least it has infected me already, and I really like to bring that over. Good. All right. In case I get stuck in the presentation, there are basically 3 messages I would like to place, and you can see them here. It's basically, why should we care about adolescent health and well-being? A phase in life where basically a lot of people, the young people, are healthy and relatively when you compare it to other population segments. What should we do and what should we address? And here, my main message basically is we should probably think about the drivers and an enabling environment and not so much about the health outcomes or the health conditions alone. And the how is, if you want to do that, if you want to address drivers and if you want to create enabling environment, you probably need to work across sectors and across different actors, and you can't just stop with the health system, though admittedly, of course, the health system is always important. Let me move on. Okay, now I've managed. Now we go a little bit into a deep dive, the 3 questions: why, what, how. And the first message is, if we talk about adolescent health and well-being, it's actually not just about the adolescent health today. It's not that somebody young doesn't attract malaria or doesn't become obese, but actually there's what the Lancet Commission calls the triple dividend. If you intervene now for adolescent health and well-being, you also invest into the future of societies. On the one hand, when adolescents become adults, that has an effect, obviously, if you already invest now. But there's more and more research, especially on epigenetic studies, that show what influence it has on the next generation. That means when adolescents become adult and then parents. Now, before we go into the what, we probably should just shortly define adolescence. We all have an idea about what this is. We have probably a sibling or a neighbor that is an adolescent. It is the life strength between childhood and adulthood. I think we all agree about that. It's about biological growth, physical growth of a person, but also cognitive growth. But it's also a period where you actually undergo quite a few social role transitions. And that is, for example, from school to employment. See, that could be one. But even in many cases in the world, it can also mean basically early parenthood. And that still can take place in adolescence. We come to the age range later. And it's, what we often dismiss is actually that the responsibility of that person is growing compared to childhood, but is still coupled with, a lot of need for protection, and that we probably sometimes also omit. If we think of an 80-year-old, a 90-year-old adolescent, we think, okay, the person can vote. I mean, he or she should be quite responsible for her and his life. So adolescence, before we come to the age range, is basically, there are changing patterns in adolescence. And we all know in basically all parts of the world, puberty starts much earlier, basically, often at 10 years or 11 years. However, the end point, and this is also research that has basically brought that to the forefront, the end point is much later in the 20s, even in terms of physical maturity. It's not that basically your body, your cognitive capacities have developed with the age of 18 or 19. What we call here the semi-dependency has been expanded. That has, of course, to do with a higher degree of education, which we see among a lot of adolescents worldwide. So that means they are financially, economically, probably longer, for example, dependent on their parents, their wider family, than it has been in the past, where young people often started working with 15 and 16. We are all aware. This is still the case in many, many societies, obviously. So it depends very much on the context. So all of that brings basically the Lancet Commission to the recommendation, and that's actually also the definition in terms of age range we use in the Fondation Botnar. Adolescence is from 10 to 24, grosso modo, and that means it's much wider than probably the narrow definitions we have had in the past, which was more around 15 to 19. Now, if we talk about adolescence, it's quite striking also to see the mere number. We actually talk about nearly 2 billion people in the world. So I guess already for that, it's probably not completely appropriate to neglect that population segment when we talk about global health, even if we know that, relatively health conditions or ill health conditions are less prevalent in that population group proportionally. So we've talked about 1.8 billion, and 600 million are young adults, really between 20 and 24, but still being, adolescent. From the why to the what are the challenges, even if we keep the triple dividend in mind, that we see and that adolescents face nowadays? I find this quite striking as a figure when I just looked it up recently again. And it mirrors quite a few things. If you still remember Millennium Development Goals, and we are all aware of the Sustainable Development Goals, what we see here is that the Millennium Development Goals and the action behind it helped a lot to decrease mortality among under fives, but not for newborn, where it basically slightly increased even from 1950 to 2019, from 50 to 54. But of course, the shocking figure, especially when you're passionate about adolescent health, is to see proportionally, it's now 20% of the mortality here really is among adolescents. Now, I tried to zoom in into two cases, and this is not to say that communicable diseases, malaria, HIV, TB are not a problem among adolescents. Of course they are, and it depends again on the context. For example, in the southern part of Africa, HIV, new infections in adolescents is still a major challenge. But I'd like to draw your attention on obesity, a risk factor basically, for example, for diabetes, type 2 diabetes, but also, cardiovascular diseases later on in life. And I probably ask you, what do you see? There are three main messages in this graph. Think of the triple dividend. If you can just shout in, if anybody has an idea, what do you see here? You basically see one first message, obesity goes up in all parts of the world. So if we think this is a disease of prosperity, probably not so much. It has increased over time in all parts of the world. What we also see, message too, apparently among males, this is much more pronounced. And the third message is, if you look at the age ranges, it starts in adolescence and it builds up into adulthood. So you lay the basis in adolescence, and it goes up and it comes to its peak when the adolescents become adults. Now, this translates, if you take the risk factor, it translates into, for example, diabetes type 2 incidences. Again, here, it's a bit of a busy graph, but what you basically see that a lot of the cases, the incidences appear in the age range 15 to 19, 20 to 24. This is where the big increases start. The numbers, of course, are higher in relative terms, also when people are older, but it really starts in that age range, 15, 19, 20 to 24, where we see major increases. Now, I've talked about, what, and I think, this is not exhaustive, but it shows you at least, what we also aim to do in the foundation more and more. Think of the different drivers that probably are context specific very much, and also come in combination that basically then drive the health outcomes I've just shown, because they are only health outcomes. But if we want to address the drivers, it's probably not only treatment and care in health systems, but you would think of those factors that basically lead to obesity, and then probably even diabetes or cardiovascular diseases later in life. And I think, Suzanne, you have referred to the healthy lifestyle. So part of these elements are here. Of course, it's about physical activity. But if we think of cities where a lot of adolescents nowadays and young people live, it's also about, do they actually have the possibility to move and be physically active? Or are they basically in a cage in their little flat or in their little house in a mega city? Now, second zoom in after NCDs, if you will, is mental health. Another sort of time bomb that is not even hidden anymore. I think with the COVID-19 pandemic, we've seen also the effects on school children, adolescents, and younger adults who couldn't get out anymore into their peer relations and also have physical activities. So also here you see, with the example of depressive disorders, here we talk about already a clinical condition that has been diagnosed. Mental well-being, of course, has got other facets where we don't necessarily talk about a mental disorder yet. That could be different forms of stress, for example. And what we see here is that among females, one of the key message, again, the rates are much higher. And again, the steep increase is basically from early adolescence into 15 to 19-year-olds. And again, like the message before, you lay the basis for mental ill health or mental health challenges very often adolescents. And if you take this figure here, you see that already 75% of all mental health challenges start before the age of 24. It's nothing that comes later in adulthood like that, but basically it's being nourished from adolescence onwards. And again, a few drivers which we know from research that drive different types of mental health challenges. And you work on air pollution, that could be one, but noise pollution definitely is one. Air pollution is a little bit more hidden, but it also does stress people and also adolescents, for example, and other phenomena like climate change. To sum up a little bit, when we talk about the drivers, to zoom out again, and what I said before, you've got health outcomes, but we should really focus more on the environment, on the factors that play into these different health outcomes, and oftentimes combined. And here you see some what I would call the mega trends. And certainly one is digitization. It's got upsides and downsides for adolescent health and well-being. Urbanization also has got opportunities, but also threats. the increase in inequalities, and I think, Suzanne, you referred to one of the keynote, I think, is on inequalities, I think very important topic. And then obviously climate change, environmental pollution, but also marketing and commercial determinants, especially when you talk about food, beverages, gambling. This has an enormous effect on young people's behavior. Now to the how, what could we do? And, you know, this is probably a little bit not only in my opinion, you can also find it in the Lancet Commission on Adolescent Health and Wellbeing papers, few of these elements. As I said, I think we need to focus more on structural conditions and of drivers of well-being and not just on the health issue, diabetes or obesity alone. Then it's probably a mixture of different elements we need to bear in mind. It's about promoting health now, even if adolescents don't have an issue. It's about preventing ill health, but it's of course also about managing chronic conditions as for other population groups as well. Now, a specific element which I find important, I think where we don't have come to a conclusion in the global debate, but I think we need to lead that discussion. And yeah, it would be keen also to hear from Martina Tugala what you think, what the right balance is. I think we often hear about, yeah, we need to promote healthy lifestyles and behavioral change also among adolescents. And that's probably about agency, you know, to equip young people to have the skills and capabilities to navigate, to act, to move. I think this is a very important part, but what we shouldn't forget, and then we come back to that definition, is actually that we shouldn't forget that even adolescents who are adults under law need still some some types of protection by law, by regulation. And that is, of course, the harmful bit, because we know we enter political discussions where it's sometimes not easy to take measures. And I was referring to food and beverage, for example. We all know from different countries, or tobacco, how difficult it is to limit marketing for children and young people, for example, also online. And we had that debate in Switzerland, even with the vote, to push through such measures. Now, concretely, I think we need to probably look at least these three elements where action is needed. Evidence for those who are researchers. Very important. I think we need globally comparable data that we actually can see what are the issues in each society, each country, but we also need context-specific evidence. And evidence, there are probably different types of evidence. It's not just scientifically rigor evidence, but it can also be the views, the experience of different people, of young people, but also other stakeholders who work for the benefit or want to work for the benefit of young people. Practice and policy, I was just referring to that. You know, on the one hand, we need probably more adolescent-friendly services, and that could already start. And I think also here we see little movement around pre-service curricula. What is actually in pre-service curricula in different countries around adolescent health? Very often sexual and reproductive health. But as we've seen, there are other phenomena that probably should also be taken into account, and that health workers should be better prepared. But most importantly, health promoting environments in families, among peers in schools and communities is important. That means we need to work with other sectors, and especially with the education sector. And last but not least, the agency. Of course, we need to find new and better ways of meaningfully involving young people. Financing is always an issue, not only for adolescent health. There are some international funds like the Global Financing Facility that has expanded its mandate from maternal, newborn, and child into adolescent health. To finish off, and then, yeah, we can start with the young people's voices. This was an attempt from my side to show one possible pathway if we talk about drivers and entry points for action, be it policy, practice, evidence gathering, where we can quite nicely see, and again, that can differ a lot from society to society, from local context to local context. If we, for example, accept that early marriages, which we see in many societies, that young ladies become pregnant very early on, And early parenthood then basically leads not only, but especially for young ladies, to curtail shorter education, exclusion from employment, special form of employment, and then also during pregnancy and afterwards to poor nutrition for herself, but also for the children. The question is, where's the entry point? And if we talk about drivers, it's probably more to the left, but it's also the more cumbersome, because it's about social norms. How do you go about, that sometimes very strong social norm and value that you need, get married early or find a partner, and it's probably more about two families coming together than two individuals. But what we often see in global health, of course, our entry points are here, but they probably don't always hit the point. It's not to say that they're not important, but probably not important alone. I stop here before we bring in a few young people's voices, which we've actually asked about their health and well-being in Kigali lately when the Women Deliver conference took place. Just want to alert you to the Global Forum of Adolescents that will take place virtually on the 11th and 12th October. There's plenty of material and actually also plenty of opportunities to contribute online in various rounds of discussion to a vision for better adolescent health and well-being. It's not health focused, it's got really different topics.
Oh, thank you very much, Alex, for this really insightful, also worrying talk. But what I find is, as troubling as it is, I also see a lot of hope and a lot of answers. So I wanted to ask our fantastic panelist of young people, your perspectives on health and well-being from for you. What is health and well-being? What is important, do you think, for people of your generation? Tugala is joining us from the UK and is here participating in the MEM this week. So thank you for joining us as well. But Tugala.
Health, I think things like obesity and diabetes and things, it can be quite context dependent. I mean, there's so much on kind of access to food and things like that, and that's kind of a bit more prominent in specific cultures. For example, in the UK, 1 in 3 children who leave primary school are considered to be overweight. But there's certain regions of the world that aren't in the same kind of context. There's kind of more prevalent issues, and especially at the moment with the ongoing conflict in Ukraine and how that's disrupted supply chains with food. There's whole regions that have been plummeted into food insecurity. So I think mental health is probably the main issue that affects people globally, young people globally. And so for me, that's probably the primary concern for young people's well-being across the board.
Martina, so one of the questions that Alex raised during his talk was, how do we involve young people? What do you think? I mean, I've known you for a little while now, as you followed my course, and I was so impressed with your perspectives and your concern about health and young people. How do we engage young people in finding solutions and creating a better environment?
Yes, I think it's really hard nowadays to involve young people because there is so much information about a lot of things coming from everywhere. So it's really important knowing how to target young people with the right information and the right tools, and with something about health that can be considered quite boring sometimes for young people. It's really hard. So the first thing is that we should talk more and more about these topics, and especially in the environments that young people are in. So I guess the first thing is that everything should start from family. Family should be alongside young people, their children, siblings, and so on. And we are taking for granted it, but it's not like that, because a lot of young people live in a family environment where health is not considered as important as other things, especially, as she said, mental health, especially sometimes it's not considered as important as physical health. So we should talk with our siblings, with our children, and make them feel understood, and if there is any problem, they should be able to speak, both for physical health and mental health, especially.
Can I answer?
Please.
I agree. I think it's been traditionally quite difficult for, educators and policymakers to get young people interested and involved in the question of health, because I mean, historically, youth has kind of been synonymous with health. There's been so many references in film and literature about the fact that young people see themselves as invincible, and it's only as you age that you start to be more concerned about health. But I think we're in a very kind of unique time period post-COVID where there's a rare opportunity where young people's focus has been on health. I mean, the world's kind of global discourse for the past few years has been centered on health, and for the first time in kind of our generation, young people across the world, even in cultures where there is kind of times of peace, there hasn't been kind of war, are kind of faced with their own mortality. So I think although it is a difficult task to get young people to care about health and be involved in health, there's a very rare opportunity at the moment where it is something that young people are concerned about, and it's something that the world has kind of put a lens on and focused on for the past few years. So it's a rare opportunity to be monopolized upon, that governments and educators can kind of use this as a way to extend the conversation.
I love that you use the word monopolize this. This is really an opportunistic perspective.
Yeah.
Fantastic. Ria, you're joining us from Bangladesh and you are on mute. So I'll ask you to unmute yourself now. Thank you so much for joining us. My question for you is, what is important to you in terms of health and well-being for young people?
Thank you for your question. What's important for me as a young person is feeling good both physically and mentally. I want to have energy and not feel stressed all the time. Having knowledge about healthy foods and a healthy lifestyle is also very important to me. I worry about feeling stressed and unhealthy lifestyle a lot. School and social media can be taught, and I am also worried about eating unhealthy and fast food and getting overweight.
Thank you so much, Ria. Nakshatra, I'd love to hear from your perspective. You are on mute at the moment, so if you can turn on your microphone. And I'd like to hear from your perspective, what do you think we can do to really promote youth health and well-being?
Thank you all. Firstly, we should learn how to care our feelings and our bodies. And also we should make sure that we have a group of community of health conscious people, and we should make a network of those people who want to follow a good lifestyle and a healthy lifestyle. And meditation and yoga is also very important for it, because when we meditate or practicing our religious activities, it helps us to control our outer negative emotions, and it is very important for us. Thank you all.
Thank you very much. I'm going to ask each person on the panel one last question, and then I'll turn it back over to Alex. If you could have one thing, or if you could ask one thing of world leaders, local politicians, teachers, whomever it may be, somebody who has the power to do something, what would you ask them? Martina.
I guess spread awareness about health and make feel young people involved. I guess, and I just wanted to add something about what she said earlier about being invincible and what I said about being understood with a personal experience. Last spring, I had some heart-related issues. I got pretty sick, and the first thing I got told by the doctors, all the doctors, was that I was crazy, that I was making all up, because it was impossible that a young person like me, living an healthy life, practicing sport all the time, could have such issues. And that was not good also for my mental health, because I felt like they made me believe I was crazy for feeling what I was feeling, for feeling sick. And I was not feeling understood by the people who should have helped me. So I would say to the government and local government politics to change that, and to make young people feel understood by the environment, also the medical environment, because sometimes it's not like that and can be really frustrating.
So you want respect and to be
Yeah.
validated
Yes.
and to be listened to.
Yes. The first
Yeah.
thing, sometimes when you are not feeling well, they tell you it's stress, it's anxiety, you're studying, so you have to be stressed all the time. That's the main reason they tell you you're not feeling well, or you're having some trouble, some issues, some health related issues. So it's not nice when you're there, you're suffering, you're feeling pain, and they make you feel crazy, or like you're inventing, making everything up, just because I got told I wanted attention. So yes, that's something that should change.
You know, I heard at the European Health Literacy Summit some years ago, one of the keynote speakers said something that has always resonated with me, and you've just reminded me of the statement. He said, "No innovation without irritation." And I'm irritated. So let's get innovative. So Tugala, what would you ask?
Well, I can actually echo your experience almost exactly, which is quite sad. I have kind of a long-term health condition, which is to do with kind of autoimmunity, which affects like mostly people aged 15 and up, so a lot of young people, and 80% women most of the time. And on average in the UK anyway, it takes about 6 years to be diagnosed. And so it's such a long process. And I had a similar experience where I was kind of told, there's nothing wrong with you, like you're fine. And especially in this kind of disease where each time you have a flare up of symptoms, they're different symptoms. So there's not really until a long time's past a kind of lineation. So people are saying like, oh, it's in your head, there's nothing wrong with you, which is why it takes so long to be diagnosed. So I can say the same. It's kind of the trivialization of women's pain specifically. And I mean, there's a long history of kind of in the UK anyway, it wasn't that long ago where women would just be diagnosed with hysteria when they had mental health issues. And so there's a long history of the trivialization of women's pain, but equally there's also a stigma around male pain, as specifically mental health issues. So gender roles kind of really affect both genders. A lot of men they're kind of challenged by the specific gender role of having to be strong and be kind of powerful. And so there's not really room to have kind of mental health issues in this kind of culture. So I think the governments can do a lot more to provide support and kind of try and tackle these roles and make people feel heard. So yeah, I agree with you.
Thank you. I would ask Nakshatra, if you could ask those in power, those who can actually do something to support young people's health and well-being, what would you ask?
In this modern era, we have many mental issues or many mental health related issues like anxiety, depression, or others. So how can we control our inner emotion? And what can we do with this kinds of stuff?
Thank you. Thank you very much. I think we have a lot of agreement in the room here as well. I'd like to turn it back over to Alex.
What I hear from Tugala and Martina, I think resonates a lot with me. Yes, there is a policy bit to it, and governments who should listen better. But I think it's also that governments need to take concrete action. What could that be? And if I listen to your two cases, it resonates with me in terms of pre-service training that healthcare workers need to act differently and have got different concepts in their mind. And I mean, I have also experienced that in Switzerland because of specialized care that just look at isolated bits and pieces and say, well, young person, this doesn't fall into this category, it can't be that. Instead of looking at you more holistically and say, at least think through what could be, you know, the different factors that are probably linked. And we all know it's very complex, but I think we need to shift also healthcare workers, social workers in schools as well. I mean, I've heard in Indonesia lately, I saw four schools, and the school social workers clearly said we are not able to detect mental health stressors. We see it a bit, but we don't know what to do, where to refer to, and what could be the first action we should possibly take. Is it, you know, family, contact with family, or just not? Because that could probably also confront that young person. So I think here we need, yes, awareness, but we also need, I think, better skills, you know, for healthcare workers within families, as you said, probably with peers as well, that peers can also detect more easily instead of probably putting a stamp on you and say, well, she's a bit bizarre. I mean, push her aside. Yeah.
Wait, I also have another thing to say about kind of more concrete things that governments can do. I think they need to be a bit more on top of kind of predatory marketing that specifically targets young people with kind of dangerous habits. So for example, in the UK, we have a lot of legislation that protects young people, or not protects them, but in terms of smoking and tobacco, you have to have a warning label on the tobacco, and you have to have an image that represents like the negative effects of it. But recently, when we've seen the rise of kind of vapes and flavored vapes and things, it's really quite worrying. It's very predatory marketing, because suddenly it's not just a pack of tobacco, it's something that is brightly colored and it's flavored very sweet, and it's something that would apply and almost seems like it's like marketed directly towards young people. So something like that, I think governments need to be a lot more on top of legislation to protect young people from that kind of sinister marketing that seems to target them. I know the US, certain states have implemented bans, and a lot of kind of European countries are in the process of that. But I think that's a big part of the responsibility of the government, is to try and safeguard young people from like emerging threats like that.
Yeah, probably just to finish off, this is why I would, of course, argue for more of a mixture of measures, because if we only go with awareness or basically around behavioral change, we basically put it on the individual's shoulder. And if you analyze marketing strategies, this is actually what is at the core of it, to say, even if you see sometimes awareness campaigns actually financed by, for example, alcohol industry, that they basically twisted the way that is, well, it's individual behavior, moderate yourself, but it appeals to that person to say, well, drink alcohol, but moderate yourselves, up to you to determine that. While probably, as I said, for some people, there needs to be bits of protection, probably even for quite a few adults.
Indeed. So what we can do today is we've started this conversation, and it's clear to me that this is just the beginning, and we need to continue this, not just talking, but we need action. And I want to thank Alex for bringing this topic to the summer school, for leading this fantastic discussion. And I want to thank each of our panelists, Martina, Tugala, Ria, and Nakstraka, for joining us. Thank you very much for your contributions. And all of us together need to work much harder and much better, not just work more, but work better at prioritizing youth health and well-being.